Men over 60, let me start with something that may surprise you. If you are measuring your sexual health by how often you perform or how long you last, you are using the wrong ruler, and that misunderstanding is quietly damaging confidence, relationships, and self-worth far more than aging itself ever could. I see this every week in my practice. Men lower their voices and ask a question they feel embarrassed to say out loud. Dr. Zion, how often should I still be having sex at my age? And is something wrong with me if I can't do what I used to? If you've ever asked yourself that, you are not alone, and you are not broken. I'm Dr. Michelle Zion, and I specialize in men's hormonal health, aging physiology, and sexual wellness. Today, I want you to listen carefully, because midway through this conversation, you will realize that most men have been measuring sexual satisfaction the wrong way for years. Sex after 60 is not about competing with your younger self. It is about understanding how your body works now and learning how to work with it instead of against it. When that shift happens, intimacy often becomes calmer, deeper, and more fulfilling than it ever was in youth. Sex changes after 60 for clear biological reasons. Testosterone naturally declines with age, beginning gradually in midlife and becoming more noticeable after 50. By your 60s, this decline can affect libido, erection firmness, recovery time, and energy levels. This does not eliminate desire. It softens it. Desire becomes less urgent and more selective. That is not dysfunction. It is normal aging physiology. Circulation also changes. Erections depend on blood flow, not effort or desire alone. As blood vessels age, especially in men with high blood pressure, diabetes, or cholesterol issues, blood moves more slowly. This can lead to erections that take longer to develop or feel less firm. This is not failure. It is how the vascular system evolves over time. Medications also play a role. Many men over 60 take medications for blood pressure, diabetes, or heart health, and some of these can reduce libido or interfere with erections. Beta blockers may dampen arousal signals, and diuretics can affect blood volume. This does not mean medication should be stopped, but it does mean sexual health deserves to be discussed with a physician. Often, small adjustments make a meaningful difference. Psychological factors are just as important. Many men feel pressure to perform the way they once did, and that pressure creates stress. Stress activates the fight or flight response, which directly suppresses erections. The moment sex becomes a performance test, the body resists. So how often is normal after 60? There is no single correct number. Research shows many men in this age group have sex once or twice per week, while others are satisfied with intimacy every 10 to 14 days. Both are normal if both partners feel fulfilled. I see men of the same age with very different rhythms based on health, energy, and relationship dynamics. What matters is satisfaction, not frequency. There is no scoreboard, no requirement, and no deadline. Many men worry about duration and assume shorter intercourse means failure. In reality, studies show that average intercourse duration for men over 60 is about 3 to 7 minutes. What matters far more than penetration time is the full experience of intimacy. Touch, closeness, conversation, affection, and emotional presence often matter more than minutes on a clock. When men stop measuring sex by duration alone, satisfaction often increases dramatically. Your body gives clear signals about balance. If sex leaves you exhausted, dizzy, or short of breath, the intensity or frequency may be too high for your current health. If emotional distance is growing between you and your partner, a lack of intimacy may be part of that gap. The goal is balance, not excess and not neglect. Improving sexual health after 60 starts with lifestyle foundations. Daily walking improves circulation, supports cardiovascular health, and directly benefits erection quality. Nutrition matters. Foods rich in omega-3 fatty acids, zinc, magnesium, and antioxidants support hormone balance and blood flow. What benefits your heart benefits your sexual function. Smoking damages blood vessels and undermines erections, and quitting improves circulation within weeks. Hydration matters more than many men realize, as dehydration reduces blood volume, energy, and stamina. Mental health is equally important. Comparing yourself to your younger self creates stress and frustration. Open communication with your partner, reduces anxiety, and builds intimacy. Silence creates tension, while honesty fosters connection. Relaxation practices such as deep breathing, meditation, prayer, or gentle stretching activate the nervous system responsible for arousal readiness. Calm is not the enemy of desire, it is often the gateway to it. Some men benefit from supplements such as zinc, vitamin D, or magnesium if they are deficient, but these are supports, not cures. Prescription medications for erectile function can help some men, but must be used under medical supervision. These medications must never be combined with nitrate-based heart drugs, as this combination can cause dangerous drops in blood pressure. Always consult a physician. Having less sex does not harm your health, but regular intimacy supports better sleep, mood, immune function, and heart health. Too much sex is only harmful if it strains your body or worsens medical conditions. Sexual activity does not stop at a certain age. It changes based on health, desire, and mutual interest. Some men remain sexually active into their 80s, while others slow earlier. Both are normal. Certain habits quietly damage sexual health after 60. Chronic sleep deprivation lowers testosterone and impairs recovery. Excess alcohol over time damages the nervous system and hormone balance. Poorly managed diabetes, high blood pressure, and cholesterol damage circulation. Emotional isolation and depression reduce the brain chemicals that support desire and pleasure. Staying socially connected and seeking support when needed protects both mental and sexual health. Here is the most important message. Sex after 60 is not about performance. It is about connection, comfort, communication, and care for your body and mind. When men stop chasing youth and start honoring where they are now, intimacy often becomes more meaningful than ever before. If this brought you clarity, subscribe for honest, science-based guidance on men's health and aging, and share one small change you plan to make. Aging is not the end of intimacy. It is a new chapter written with wisdom.